Diabetic retinopathy is a complication of diabetes, and it's caused by high blood sugar levels damaging the back of the eye. It can cause blindness if left undiagnosed and untreated. However, it usually takes several years for diabetic retinopathy to reach a stage where it could threaten your sight. Some symptoms of diabetic retinopathy are gradually worsening vision, sudden vision loss, shapes floating in your field of vision, known as floaters, blurred or patchy vision, and eye pain or redness. For diabetic retinopathy that's threatening to affect your sight, the main treatments are laser treatment, eye injections, and eye surgery. Some natural options though, you have the Korean starwort. Extracts of the Korean starwort, known as Aster carinensis, was tested on diabetic rats for its purported ability to inhibit retinal vascular dysfunction associated with the disease. The new animal study showed that the herbal extract could protect the vulnerable blood vessels of the retina from degenerative effects of diabetes. Treatment with the Korean aster extract was shown to protect the blood-retinal barrier from being affected by the diabetes, and it also preserved levels of occludin, which is a tight junction protein that's vital to the blood vessels in the eyes. And furthermore, the aster extract reduced the degradation of retinal vascular cells by a large margin. It also lowered the amount of AGE that was accumulating in the retina. Magnesium deficiency is associated with increased risk of diabetic retinopathy and poor glycemic control. Dietary supplementation may be advised to prevent such complications and to improve the glycemic control. In order to determine your dose of magnesium, you want to slowly increase until stomach discomfort or diarrhea is noticed. Then gradually reduce the dose until you're taking the maximum tolerable amount without any noticeable side effects. As magnesium is required by over 300 enzymes in the body, it can have profound benefits with continued supplementation. You want to take magnesium in the form of magnesium bisglycinate. According to some studies, vitamin D deficiency is associated with an increasing risk of diabetic retinopathy. You want to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Vitreous vitamin C, as an antioxidant, is responsible for regulating oxygen tension and oxidative stress in the eye. Oxidative stress and retinal ischemia are implicated in the development of proliferative diabetic retinopathy. The best form of vitamin C would be liposomal vitamin C, then a pH-buffered non-acidic vitamin C, with the worst kind being cheap, acidic ascorbic acid. Vitamin C's action can be enhanced when it's taken with bioflavonoids. Flavonoids can modulate carbohydrate and lipid metabolism. They can improve insulin resistance. They can attenuate hyperglycemia. They can improve beta cell function and improve the management of inflammatory processes, which could help to prevent the development of long-term chronic diabetic complications like diabetic retinopathy. A popular flavonoid is quercetin, taken in doses of 500 to 1000 milligrams per day. Vitamin K2 is extremely important to eye care. It prevents excess vascular calcification that results in age-related stiffness and atherosclerotic plaque of blood vessels found in the heart, kidney, and the retinal blood vessels. Typical doses range from 100 to 300 micrograms per day, in the form of MK7 for the best results. 300 micrograms appears to be the maximum amount that your body can absorb in a day, so higher doses are not needed. A wide range of evidence supports a role of CoQ10 in retinal disease through inhibiting production of reactive oxygen species and protecting neuroretinal cells from oxidative damage. Ubiquinol is the most bioavailable form of CoQ10, with up to 6 times greater absorption than the cheaper ubiquinone. Doses can range from 100 to 400 milligrams per day. This helps the mitochondria. You can see my other videos on supplements for the mitochondria for more information about this. This is because the mitochondria are responsible for generating energy in the form of ATP, which is adenosine triphosphate. And the ATP generated from the mitochondria is the key factor that couples the blood glucose levels with insulin secretion. Several recent clinical trials highlight the potential role of astaxanthin in promoting eye health, as suggested by the significant improvement in the outcomes of various ocular diseases, including diabetic retinopathy, age-related macular degeneration, glaucoma, and cataracts. The powerful antioxidant, which is found in salmon, prawns, crabs, and other marine life, is natural, safe, powerful, and multifaceted as an anti-inflammatory, with potential in the treatment for diabetes and insulin resistance. It's said to be 6,000 times stronger an antioxidant than vitamin C. The typical dose of 12 milligrams of astaxanthin per day would require you to eat 1 whole wild salmon to get the same amount of astaxanthin. Omega-7 from buckthorn oil. It's been highly researched in its ability to solve the underlying causes of dry eyes. It's been shown to reduce dryness caused by inflammation and also improve tear secretion. Furthermore, a healthy balance of fats helps your tear gland to produce healthy tear secretions, which will be less likely to dry your eye out. Although there's only a small amount of evidence for omega-7 specifically for retinopathy, it may be beneficial to help support the eyes, especially if one suffers from dry eye syndrome, which many diabetic patients do. Owing to their anti-inflammatory and anti-angiogenic properties, omega-3 fatty acids alleviate major etiological agents. These fatty acids are renowned for their beneficial effects in various cardiovascular and other disorders. It may also be an effective prophylactic agent, which markedly inhibits the advent of retinal angiogenesis, and it prevents the apoptosis of retinal endothelial and neuronal cells, thereby averting retinal degradation, hence safeguarding diabetic patients from the sight-threatening complications of diabetic neuropathy. Typical doses are 3 to 9 grams per day of an EPA DHA molecularly distilled fish oil blend.